At the beginning of the pandemic, Liberty for Youth put together a youth council. Each youth council member had a specific role, and Madeline's function was to research and provide solutions specifically for mental health.
Being a survivor of mental health, I know the importance of the work that we're doing here at Liberty for Youth. After conducting research, we narrowed it down to 3 main focuses for our mental health program: physical activity, nutrition, as well as educating not only the youth, but those around them about the struggles that mental health have had during the pandemic.
Some of the things we noticed was more screen time, less socialization, less routine. When you close things down, when work is closed, when school is closed, when extracurricular activities are closed, there's less physical activity, there is less focus on nutrition. And that brought us to think that coming out of the pandemic, it's going to be necessary to teach youth proper exercise and proper nutrition.
One of the strategies that we came up with is a running walk exercise group that will take place weekly at the Seven Earths Ranch. This will include all 3 pillars: the physical activity aspect, the nutrition aspect, as well as the education aspect.
After we do the run walk, we would bring in a little bit of more holistic nutrition so they understand that not only is physical activity important, but giving yourself food for the mind is also extremely important for better mental health.
Through our research as well as my personal experience, I have found that there are many resources out in the community, but they're not usually readily available.
Navigating the mental health system is extremely difficult, so we wanted to create easy, accessible resources for youth and families in our community.
The problem we noticed was that going through these many websites and trying to find the resources that are accessible in the community is very complicated, and usually halfway through the list you lose motivation and give up on continuing to find these resources. So our solution was to create a QR code that has 3 main sections to it: youth resources within the community, family resources, as well as coping strategies that youth can access at any time whenever they need it. Something from personal experience: when I was homeless, when I was trying to find a shelter, it was so hard to navigate. So this QR code will break that time down tremendously.
Not only there's a mental health crisis with the youth, but youth actually getting access to these services is a crisis.
We've seen that the wait times for youth and children in Ontario can be as long as 2.5 years. And also during the pandemic, the wait times have almost doubled. There's different programs for different mental illnesses, but the 2 that would connect with the youth the most is the cognitive behavioral therapy, as well as the dialectical behavioral therapy. So our solution in this is having our staff trained and certified to be able to teach the youth as well as parents and volunteers these techniques and methods in DBT and CBT, so that we're able to decrease these wait times, ultimately giving easier access to the youth in the community. Going through these programs, it's helped me a lot. That's why it's very important that we have our staff trained and able to teach these coping mechanisms and strategies to the youth in our program.
The importance of this is that we want to give the youth the tools to be able to manage their mental health on their own.
Funding raised from Frederick's Recovery Run are pivotal in making programs like these a reality.
We need your financial support so we can ensure that every youth experiencing mental health struggles can access support services they need and develop the tools for a healthier and happier future.